Have you ever noticed how garlic gets all the attention in the culinary world? Yet, ginger quietly sits in your kitchen, acting like a natural medicine chest. This little golden root is packed with antioxidants, almost as much as pomegranates and berries. It supports your heart, helps manage cholesterol, fights infections, eases arthritis pain, calms menstrual discomfort, improves digestion, and even helps with weight control. No wonder so many people call it a super spice. But here is the problem that almost no one talks about. Ginger is powerful. So powerful, in fact, that for some people it can be harmful. Yes, even completely natural foods can act like medicine in the body. And anything that acts like medicine also has situations where it should not be used. If you fall into one of the 8 specific health conditions we are about to cover, ginger may irritate your stomach, interfere with your medications, disrupt your blood pressure, thin your blood too much, or even increase your risk of serious complications. If you are in the last category we discuss, ginger should be avoided completely. But don't worry, we are not here to scare you. We are here to help you use this powerful root safely, wisely, and in a way that truly supports your health after 50, 60, and beyond. Welcome to Senior Prime Life. Stay with me until the end, because after we go through the 8 warning signs, I will also explain when ginger is safe and how to use it properly. Let's begin. Health problem number 1, gallbladder disease. This includes gallstones, inflammation, or blockages. For most healthy adults, ginger is a digestive hero. It warms the stomach and supports smooth digestion. But if you have gallbladder issues, ginger can shift from soothing to dangerous faster than you realize. Here is why. Ginger naturally stimulates the gallbladder to release bile. Normally, this is beneficial as it helps break down fats. But if you already have gallstones, that extra stimulation acts like stepping on the gas when the road is blocked. The gallbladder contracts harder to push out bile, but the stones obstruct the exit. This leads to sudden, sharp pain under the right rib, nausea, or spasms that radiate into the back. In severe cases, it can cause dangerous inflammation. For seniors who often have slower gallbladder motility, this reaction can escalate quickly. Concentrated ginger, like shots, capsules, or powders, is the riskiest form. The advice: if you have gallbladder issues, avoid ginger supplements completely. Use culinary ginger only in very small amounts and stop immediately if you notice pain. Health problem number 2, surgery and medical procedures. If you have an upcoming surgery, even a minor one like a dental extraction, ginger should be approached with extreme caution. Most people think it's natural, so it must be harmless. But ginger naturally thins the blood. Its active compounds reduce platelet aggregation, meaning your blood takes longer to clot. Before surgery, this increases bleeding risk. Surgeons worry about 2 things: excessive bleeding during the procedure and difficulty stopping bleeding afterward. Even if you only consume ginger tea or candy, you may unknowingly weaken your body's ability to form clots. This is especially true if you are over 60, when the bloodstream naturally becomes more sensitive. Clinical reports show that patients consuming ginger before surgery experienced more bleeding and slower recovery. The rule is simple: stop consuming ginger at least 7 days before any procedure. For major surgeries, aim for 14 days. And remember, avoid it immediately after surgery as well to allow your tissues to heal properly. Health problem number 3, ginger sensitivity or allergy. For most, ginger is soothing, but for a small group, the reaction is the opposite. If you are sensitive to ginger, even a tiny amount can trigger heartburn, stomach aches, diarrhea, or excessive gas. Some people develop skin redness or itching, signs that the body sees ginger as a threat, not a remedy. In rare cases, the immune system releases histamines, leading to tingling around the mouth. Many seniors use ginger daily to soothe nausea, never realizing that the very thing they are using to heal themselves might be the cause of their distress. If you notice unexplained reflux or skin irritation after eating ginger, listen to your body. In this case, avoiding it is the safest path. Health problem number 4, taking high blood pressure medication. Ginger is often seen as heart-friendly, but if you are taking medication to lower high blood pressure, ginger can quietly push your numbers too far down. Ginger contains compounds that naturally relax blood vessels. When this effect stacks on top of medications like beta blockers, calcium channel blockers, or diuretics, your blood pressure can plummet. This double effect triggers hypotension. You might feel dizziness when standing, sudden weakness, blurry vision, or cold sweats. For seniors, dangerously low blood pressure increases the risk of falls and even stroke. Because seniors already face naturally lower blood pressure in the mornings and have stiffer arteries, even a small amount of ginger hits harder after age 60. What should you do? If you are on blood pressure meds, do not take ginger daily without medical clearance. Monitor your numbers closely. Health problem number 5, existing heart conditions. If you have a heart condition, ginger's effects can be risky. Active compounds in ginger stimulate circulation. For a sensitive heart, this can create instability. It can drop blood pressure too low, as we discussed, but it may also influence heart rhythm. Ginger can slightly alter how electrical signals travel in the heart. If you have atrial fibrillation or use a pacemaker, even small changes may trigger palpitations or fluttering. Furthermore, ginger interacts with heart medications, intensifying the effects of blood thinners and antiarrhythmia drugs. This creates an unpredictable environment in the bloodstream. Safe guideline: if you have a heart condition, avoid ginger supplements entirely. Limit culinary amounts and always check with your cardiologist before drinking daily ginger tea. Health problem number 6, diabetes. For most, ginger helps control blood sugar. But if you have diabetes and take insulin or glucose-lowering drugs, ginger can push your numbers too low. Ginger naturally increases insulin sensitivity. When combined with diabetes medications, the effect is like turning down 2 separate volume knobs at the same time. This sets the stage for hypoglycemia. Symptoms include lightheadedness, shaking, and sweating, which can escalate to confusion or fainting. Many seniors mistake these signs for simple fatigue. The timing matters. Adding ginger to a smoothie without adjusting your medication can be risky. Because ginger's potency varies, results aren't always consistent. Advice: always speak with your doctor before adding ginger to your routine. Monitor your blood sugar closely. Health problem number 7, pregnancy. Ginger is famous for easing morning sickness. However, its medicinal effects can be too strong during pregnancy, especially in concentrated forms. Ginger stimulates smooth muscles and increases blood flow to the pelvic area. While small amounts in cooking are usually harmless, stronger doses, like shots or tinctures, can potentially stimulate uterine contractions. Additionally, ginger's blood-thinning effect can be risky during pregnancy, as women are already in a delicate hormonal balance regarding clotting. It may increase the risk of bleeding. Experts recommend pregnant women should stick to very small, food-level amounts of ginger only. Avoid supplements completely unless approved by a doctor. Health problem number 8, bleeding disorders. If you or a loved one has a bleeding disorder, ginger may need to be avoided entirely. Ginger prevents platelets from clumping together. If you have conditions like hemophilia, low platelet count, or chronic anemia, your body already struggles to form clots. Ginger makes this harder. Even small injuries could lead to prolonged bleeding. For seniors with fragile blood vessels, this is a significant risk. If you take blood thinners like warfarin or aspirin, Adding ginger amplifies the thinning effect dramatically. The rule is clear. If you have a bleeding condition, ginger, especially in supplement form, should only be used under strict medical supervision. The benefits for healthy people. Now, if you do not fall into any of these risk groups, ginger remains one of nature's most powerful healers. It is rich in antioxidants that reduce joint stiffness and inflammation, major concerns for us as we age. It calms the stomach, improves digestion, and reduces bloating. Its warming properties support the immune system during cold and flu season. And for circulation, it gently promotes blood flow, helping oxygen delivery throughout the body. Used wisely and in moderation, ginger is a simple way to support vitality. So conclusion is, ginger is powerful, there is no question about that. For most, it adds warmth and health to daily life. But as we have discovered, even healthy remedies aren't safe for everyone. If you have bleeding disorders, diabetes, heart conditions, or take specific medications, ginger can work against you. The goal is not to fear ginger, but to respect it, to understand when it heals and when it complicates. If you fall into any of the 8 categories we discussed, please talk to your healthcare provider. Your safety comes first. If you are not in those groups, enjoy ginger confidently. A little freshly grated in your tea or soup can support your health in meaningful ways. If this video helped you understand ginger better, please take a moment to like, subscribe to Senior Prime Life, and turn on notifications so you never miss our next guide. Share this with someone who may be using ginger without knowing the risks. It might protect their health more than you realize. Tell me in the comments, do you use ginger regularly? How do you prepare it? Stay healthy, stay informed, and I will see you in the next video.